Hi everyone, welcome to researchmd.com. We're going to take a look at ketogenic diet. That's like we're starting the whole topic about ketogenic diet. My name is Pramil Cheriyath. I'm a director of research, director of internal medicine residency and the transitional residency. I teach medical students and residents, and I'm an assistant professor of medicine to major medical schools. So we're going to talk about ketogenic diet. So some interesting fact about ketogenic diet. It's a diet recommended as a non-pharmacological treatment of medication since 1921, started with the refractory seizures or epilepsy. Okay, principal therapeutic option for diabetes before discovery of insulin. So when there was no insulin, they were trying to do that before. Mechanism of weight loss is mainly associated with the reduced insulin level, and insulin inhibit the breakdown of fat in the adipose tissue by inhibiting the intracellular lipase that hydrolyzes triglyceride into released fatty acid. Okay, now what is the component of ketogenic diet? It's a protein. There's minimal carbohydrate. Protein 1 gram per pound per body weight per day. Carbohydrate not more than 20 grams total per day. And remaining caloric need come from fat, approximately 70 to 80%. Typically used fats are medium chain triglyceride. Most people can use coconut oil. So if you look at the metabolism, let's look at the normal metabolism and what the body does in keto diet. Okay, in the normal metabolism, you got mainly we eat like a lot of carbohydrate, right? That's converted into glucose. Then you have metabolic pathway and going to glycolysis, and then some of them is kind of stored as a fat, but the other one is kind of released for energy production, oxidation. You go into the Krebs cycle, and then ATP production and all that. That's a normal kind of. So what happened in ketogenic diet is mainly you restrict the carbohydrate. So the one on the left side is not going to work that much. If you look at the right side, there's fat and protein. That's like, what is the keto diet metabolism? Kind of consisted of that because we decrease the carbohydrate. If you look at so in the keto diet, there's fat, right? It's like fatty acid, and if fat is converted into fatty acid and glycerol, then you go to beta oxidation, and then you take the energy and oxidized form, goes into acetyl, make it acetyl-CoA, and then enter the Krebs cycle. And some of them also stored as a fat also, but mainly fat is breaking down, and then ketone body is produced. Okay, but if you look at the proteins, there is amino acid, there's like a transamination, that is the metabolic pathway, and then energy broke down, oxidization, go to Krebs cycle, and then energy is kind of released. Those are the main difference between when you talk about the usual carbohydrate pathway versus the ketogenic pathway. So what is the ketone production? Ketone bodies are produced from the liver, from fatty acid oxidation, and the ketogenesis occurs in liver during periods of low carbohydrate availability. And ketones are important fuel source of brain, cardiac, and skeletal muscle during starvation. Even when we sleep also, like, a lot of ketone body production is there. Thank you very much for joining. We'll be back with another presentation. Thank you.